All right, so thank you for the global tallies over the past 24 hours. Now, for more coverage of the local COVID-19 situation, I have Choi Min-jung in the studio with me. Min-jung, welcome back.
Thank you for having me, Sunny.
Right, so let's start with the tally for this Friday and the prospects ahead, Min-jung.
Sunny, Korea has seen a slight dip in the number of COVID-19 infections on Friday, with the figure coming under the 300,000 mark. But authorities are bracing for an even bigger surge in the coming days. Prime Minister Kim Boo-kyum said in a morning briefing that Korea's Omicron peak is expected to arrive within the next 10 days and that our daily case counts could reach as high as 370,000. The government has announced new changes in our testing protocols as part of efforts to prepare itself for the upcoming surge. Let's take a listen.
From next week, officials will approve rapid antigen test results provided by professionals as being official, even without results from PCR tests. Literally, it will be a rapid test, which will allow us to preemptively prevent further infections.
This only applies to rapid antigen tests carried out by trained medical professionals at hospitals and local clinics and does not include self-testing conducted at home. So those who test positive from rapid antigen testing will have to isolate and receive treatment right away without taking a separate PCR test. This after health authorities found that people who tested positive from a rapid antigen test also got a positive result from follow-up PCR testing between 90 and 95% of the time. Authorities say there are many benefits to the simplified testing procedure, as it could reduce delays in prescription and treatment that have resulted from people awaiting their PCR test results.
Right, and Min-jung, talking about treatment, COVID-19 patients here in the country are now allowed to receive medical care at regular hospital wards. Tell us about that.
Right, the government has decided to allow patients already in hospital with mild COVID-19 symptoms to be treated in regular wards. This way, hospital beds can be used more efficiently for COVID-19 patients with more severe illnesses who need intensive medical care. Infected patients will also be allowed to undergo surgery in regular operating rooms. And no extra charges will apply for hospital patients who are also being treated for COVID-19. The measure has already been adopted by several medical centers, including Seoul National University Hospital, and there have been no reports of new infections as a result of this move.
I see. And finally, Min-jung, what's the latest with regard to Omicron within the academic arena?
Right, despite the rapid surge of Omicron, most schools nationwide are still holding in-person classes. According to the Prime Minister, children are attending physical classes in more than 97% of schools nationwide. This includes students in kindergarten, elementary, middle, and high schools. Out of the total number of school children, 82% of them are taking in-person classes. But concerns are still mounting over the alarming surge in student infections. Cases among children aged 18 and under currently make up 1/4 of our new infections, and this comes despite almost 80% of minors aged 13 to 18 being fully vaccinated. But authorities said the vaccination rate for the young is still relatively low than that of adults, which is currently at 96%. Against this backdrop, the Education Ministry on Friday has decided to allow the use of saliva-based PCR testing for students. This is over concerns that regular PCR testing can be a painful and terrifying experience, especially for young children.
I'm sure it can, Min-jung. I'm sure it can. Now, let's expand our talk to include SOA.